I want to welcome Lance here to today's spotlight. Hey Lance, thanks for sharing your story in regards to your knee injury and how you've helped people through regenerative medicine with PRP and stem cells, and now how people are leveling up with AgeREcode peptides.
So there was what the patients wanted, were a lot more popular than what the patients needed. And then that wound up taking us to the next step with peptides and working on lifespan and health span and longevity medicine. Now that I'm moving again, now that I'm doing these activities again, now that I've regrown some hair, now that I've regained some sexual function, now I want to lose weight. Now I want to increase my metabolism. Now I want to stave off this neurocognitive degeneration I'm getting now that I'm getting older and older and I'm having brain fog and I'm not remembering things the way I used to. And we started working with peptides like Diexia and SS31 and Cmax and Selang to modulate mood and neurocognition and keep people sharp too. So we started out just working on kind of the physiology. Then we started getting to the other systems that support the musculoskeletal system, and then moving all the way into nootropics and even longevity medicine. We have patients we're doing biomarker testing on, trying to reduce their cellular age, using epitylon to lengthen telomeres, using FOXO4 DRI to have the body to go after senescent cells and dead cells and to reduce risk factors for developing cancers in the future based upon these people's genetic tests and biomarkers. So we've really gone this full spectrum from literally just being a patient that went through the experience all the way now developing some of the technologies and having multiple patents on these procedures like the Advanced Arthritis Relief Protocol or on the multi-stage enteric capsule delivery system we have for peptides and small molecules, making a lot of these bioavailable orally and no longer being required to be injectables anymore, which now opens it up to patients who are needle phobic, as well as providers that maybe don't have injections in their scope of practice, like chiropractors, naturopaths, and estheticians, and dietitians, and physiotherapists. So we're really expanding access to care continually, which has always been one of our guiding principles, and really blessed and happy to be able to share some of those learnings and insights with your group, not only here today, but at the Peptides Unlocked webinar we have coming up on March 25th at 1 Eastern, 10 Pacific time.
Awesome. Yeah. I mean, like you said, you've been through all the stages. You've gone through what's been going on in the market, in the industry. I know you have everything from PRP to PRF, exosomes, the peptides, and you said like some of the other protocols. Because you're so involved like with this space, what do you think like the biggest challenges that you've seen or experienced that's happening in the industry right now? Well,
first and foremost, it's got to be either misunderstanding or like misinformation. Like there's like a big one comes up all the time, like BPC 157. I get doctors and patients alike that are like, the FDA said BPC 157 has unknown risk factors. I go, yeah, it has unknown risk. There's no known risk factors. Unknown risk factors means we don't know if there's any risk factors. We don't know if there's not any risk factors. And it reminds me a lot of what stem cells were like 15 to 20 years ago. You had a lot of fear around it because there was a lack of understanding. And one of the things I love to walk providers and patients alike through, particularly when it comes to peptides, is that these are naturally occurring substances. These are amino acid chains. They're endogenous. Our body makes it. Even look at blue copper, GHKCU. We make it in our saliva and our blood plasma. BPC 157 comes from the gastric juice. It's a naturally occurring substance. So there's a big misunderstanding with this. People also think peptides are brand new. They're not. They've been used in medicine for over 100 years. Insulin is a peptide-based medication. It's been used since 1922. Peptides were discovered at the same time as proteins in 1901 by German chemist Emil Fischer. So these are not some new thing. We've known they've existed for well over 100 years. They've been used as medicine for over 100 years. They make about 10% of all new FDA drug approvals are peptides. There's hundreds of FDA-approved peptide therapeutic drugs, not just the GLP-1s and the weight loss drugs and insulin. They're much more common than people realize. The safety profile, better than people realize. Another thing we hear a lot is like, oh, there's no human data. There's no level 1 data. That is completely untrue. We've created a provider portal that has a lot of resources in it on how the peptides work, how to reconstitute them, how to dose them, how to stack them, how to use them in combination with other regenerative medicine therapies like PRP or PRF or stem cells or exosomes. And there's plentiful published human clinical literature, including level 1 placebo-controlled randomized longitudinal studies, many with hundreds or thousands of patients that have gone years or decades. So there's great data out there. There's just a lack of aggregation So that's one of the reasons why we put the peptide protocol portal together, so that there was a resource that providers could go to access that data in a simple, easy way that was purely educational and had no commercial interest and had no conflict of interest, really just somewhere you could go and gather data so that you could then understand as a clinician, what's the regulatory status of this peptide? How does it work? Who's a good candidate? What are indications and contraindications? If it's FDA approved and needs to be prescribed, what's the documentation I use? If it's a research peptide that's not approved and not prohibited and in this regulatorily gray area because there's no definition, how do I do consents? How do I do it in a study setting? If it's an FDA approved supplement, like some of our oral capsules, or if it's a cosmetic, like some of the topical serums that we've developed, how do you dispense those and use those? As long as you're maintaining with cosmetic and wellness claims, these can be done within the scope, not only of medical practices, but also non-medical practices and even retail sales. And then what are some of the alternative ways that we can deliver peptides that are needleless, such as using transdermal delivery systems and serums or compounded nasal sprays? Most of the nootropic peptides work better as nasal sprays anyway, with bioavailability, safety and risk profile, things like Cmax, Salanc, cerebrolyssin, and so forth. So really developing those resources so that clinicians could take this broad area that lacks a lot of hard data and figure out how to execute it. Much like what we did with PRP and PRF in the past, or much like researchers and clinicians like Dr. Neil Rorden did with stem cells. The research he did in Panama and the Caribbean, that became a lot of the foundational data that the whole industry used to guide future development. So we're really happy to be part of that process and to have active research and development facilities and to have collaborations with the University of South Florida Morsani School of Medicine, for example, to be advancing these therapeutics and these clinical protocols forward. And one we just started and actually unveiled at our training last week was a combination of PRP and SNAP-8. So we were using PRP and SNAP-8 as an injectable around the eyes, for crow's feet, for glabellas, for tear troughs, areas that are usually difficult to do injections and things with, as an alternative to Botox. And then combining that with PRF as an alternative to chemically cross-linked facial fillers like Juvederm. So really rounding out the full all-natural crosswalk to regenerative aesthetics, because patients are becoming more aware of what's in these things, that these facial fillers are cross-linked with polymers, with latex, with vinyl sulfone, with formaldehyde. There's that case last year that circulated the internet with the MRI, where that 36-year-old woman had the expansion of her fillers and how it blocked the lymphatic ducts. There's research coming out now showing that a lot of these commercial fillers significantly increase the risk of certain cancers, particularly lymphatic cancers. So patient awareness is increasing, and patients are more and more skeptical, especially post-COVID, because there's been so much medical misinformation over the past few years, and it's become, political, and people pick their corners. It's no longer just about science. It's an emotional battle now too sometimes, right? Yep. So people are way more skeptical, and of course they're going to go hit the AI, and depending on which AI they use, they're going to get different opinions because they're all biased and things of that nature. They all have their own corporate agendas and so forth. So being able to have the data to self-educate so that when patients come in that are a little more educated and a little more skeptical, you have the ability to engage and to educate and to course correct and to move people towards helping them make an informed decision about their health, whether it be aesthetically, orthopedically, systemically, or otherwise.
Wow. I mean, it sounds like from what you told me about the misinformation and the things that you guys provide. So you have a portal, which would be like a training portal. So if I was a doctor and I'm a chiropractor or I'm medically integrated, you have something for me that would actually train myself, train my team. Is that something that I have to pay for? What's included with me working with Juventix?
So whenever we provide products or services, we always try to give free support resources. So we've got operators manuals that have procedure note templates, consent forms, step-by-step procedure instructions with photos. We have a provider portal that you can log into on our websites that has video of the procedures being done from all the live trainings we do. So we provide all those resources for free. We've got a full-time medical director. We've got a medical advisory board and travel trainers. You can tap those resources at any time, because having a good product and a good price and good regulatory compliance, well, that's important. At the end of the day, the provider needs to know how to use it. It reminds me of that scene from Pretty Woman where Richard Gere is trying to drive the Lotus and he can't work it. He doesn't know how to drive the stick, right? Okay. And Julia Roberts' character gets in there and she knows how, and she gets the most out of that high-end, fine piece of equipment. So there's nothing wrong with the car. but the driver, if they don't know how to use it, can definitely affect the outcome. So we always try to make sure that providers and practices have the tools to deploy these tools effectively, efficiently, safely, compliantly, whether it be PRP, stem cells, peptides, extracorporeal shockwave therapy, intra-articular injections with or without image guidance. And we provide hands-on clinical training throughout the year at the events that we hold in collaboration with USF School of Medicine and also in other locations around the country. So if somebody wants to take a deeper dive, go hands-on, get reps in. We have really inexpensive weekend courses where we do that and provide certification depending on the level of need for the provider. Sometimes we get clinicians that, I haven't held a syringe since I was in my residency, and they need some hands-on reps, not just that virtual guidance. So we offer that as well, including our travel trainers that can go out and do in-office with the provider's own patients if they prefer to have us come to them versus coming to us. So all those resources are there, and it's at the level that the provider needs. Some people maybe just need to hop on a quick call with the medical director, reference our resources, use the portal, are good to go. Other folks might need more foundational hand-holding, step-by-step training. So we try to provide the whole gamut. Worst case scenario as a manufacturer is, you make this product, somebody misuses it, and then people go, oh, it's a bad product because it had an injury or it didn't have a good outcome. So, we want to make sure people know how to use the product so that it can do what it was designed to do, be as effective as it's meant to be, and not fail to perform because of, a user interface issue. A long time ago, when I was in high school and college, I had a part-time job at Circuit City. And we had a joke amongst our staff there about the people that didn't know how to use the TV or the VCR or whatever.
Yep.
It was ESO, equipment superior to operator. So I've remembered that my whole life. So I try to make sure that if we give people this tool, that they're smarter than the tool so that the tool doesn't make them look stupid. And I've kept that as a foundational thing for me throughout my career.
I like that. EOS. I'll have to remember that.
It's superior to operator. Okay. Circuit City was a wild place. We had a good time back then.
Yeah, I love that. Well, you mentioned it too, and I'm glad that you talked about that because you do have trainings pretty much, a couple times a year or maybe every quarter.
We do a large scale live clinical training at one of the university centers. We'll typically do some intermittent trainings at our clinics between then. And of course, we've got our travel trainers. We do virtual trainings and webinars like the one we have upcoming on March 25th all the time. We're going to get into protocols there at Peptides Unlocked. It's not just going to be what are they, where do they come from, how they work, but also not only how you stack them and kind of the standard protocols that you see in the books and the courses, but what we've learned in the clinic setting, like adding this or cycling in this way or co-treating with has unlocked better results, better outcomes, faster improvements, lower cost of delivery, better profit margins, something like integrating the sample capsules into the workflow. So that if we have a patient that's coming in, let's say somebody's coming in for extracorporeal shockwave therapy, we also send them home with a 1-week sample of the Recover capsule, which is BPC 157, blue copper, GHKCU, and carnosine, because we know if we're remodeling tissue, we need to modulate inflammation, we need to recruit fibroblasts and stimulate collagen type 1 through 3, as well as fibronectin, doucorin, and elastin production, which we can get from the GHKCU. So we hedge our bet that the patient's going to get a better result because we're using that outside energy therapy, inside cellular signaling. And then that takes somebody that maybe would have just been 6 sessions of shockwave, and now we've also moved them into functional medicine with peptide protocols. So some of those integrations and also how we market these things to bring patients into the practice, to expand the patient base and to increase the ROI and profit margin, it's going to be comprehensive. It's not just going to be product focused and science backed. It's also going to be practical, how you implement it clinically, how you implement it as a business owner, because everybody gets into medicine for the most part because they want to help people, or they had a positive experience, like what happened with me. It saved my knee, changed the trajectory of the rest of my life. Now I want to share that miracle with other people. But in order to help other people, you have to be able to help yourself. If you can't keep the doors open and the lights on, you can't help anybody. It's like if you're in an airplane and the air mask comes down, you put it on yourself first so you don't pass out while you're trying to help the person next to you. So I try to help doctors create the cash flow and the economic resources so that they can do the pro bono work and things and help people and still pay the rent and pay the staff and make a decent living and, not have to keep doing night shifts at the hospital and the ER, which I've had so many clients over the years that are increasing their work elsewhere to pay for their private practice It's not supposed to work that way. It should not only be able to support itself, but to support you too. So we're also going to be talking business development, marketing, and optimization on the Peptides Unlocked webinar too, not just pure clinical and science, because it's all got to work together. As you know, when you're treating body systems, if one is dysregulated, it can affect the other. Your business is no different. Every aspect of it has to work properly, or overall, you're not going to get the outcomes you're looking for. And you all know that over at MedPro Dojo as well. I mean, I'm probably preaching to the choir here. You do a lot of these same things every day, but I'm going to share our personal experiences and what we've developed in clinics so that hopefully other people can learn from the pearls and the gems that we've uncovered along the way of trial and error. And doing things wrong until we get it right, and sharing those things that worked well.
Perfect. Yeah, definitely. Like Lance said, we're gonna be covering a lot of different things. So definitely want to make sure that you guys join that. I wanted to ask you I know there's a lot of companies out there. Okay, a lot of companies are doing peptides. A lot of companies are doing stem cells, PRP. What do you think makes Juventix different? Is it your approach? What is it that differentiates you from maybe the next company?
So first and foremost, I want to say something controversial. Most of the companies, most of the products that you're going to find out there are good. The overwhelming majority of the products and companies and people in regenerative medicine are good people, good products. I'd rather see somebody using one of them or some of them than none of them, because these are great tools to offer to your patients. And the truth of the matter is, most of these products are pretty good. Even when you look at what we make with our PRP kits, there's minor differences between our products and some of the others in the marketplace. We really pride ourselves on the efficiency and the accessibility and the ease of use. So it's not only inexpensive, but very high quality. But I can look at my competitors and tell you that 80% of them do great work and have good products, right? So it's better to use regenerative medicine tools, period, than one specific one. Everybody comes on and tries to say, every other product's terrible, ours is the best, and this is why, and, don't work with anybody. It's disingenuous. Like, if you go to the grocery store to buy milk, like, you probably have your preferred brand of milk, but most milk's good for you. That's the same thing here. So first and foremost, I don't want to poo-poo on anybody. Most of the products out there are good. There's a handful not so great. But with us, it's about, regulatory compliance. Make sure you've got a good product. We always want to be FDA approved or FDA cleared or whatever the appropriate approval process is. Like with the supplements, you want to be GRAS, generally recognized as safe, for example, certification, CGMP. So that's good, because when you're working in a medical space, you always have to think about liability. What if something gets hurt? What if there's an adverse event? What if I have to make a malpractice claim? You got to make sure the company you're working with is properly registered. So we're an FDA registered establishment, facility, and manufacturer. Our PRP kits are FDA cleared. Our devices that we do are FDA cleared. Many of the medications and products we use are FDA approved, as are some of the supplements and cosmetics. So make sure you're regulatory compliant. Don't buy products off of the dark web and then hope your malpractice is going to cover you. It's not going to happen. 2, make sure there's consistency and there's published data. So with our PRP kits, we have third-party laboratory reports from places like BSR Labs that show platelet capture rate, the purity, reduction of red blood cell contamination, and so forth, so that you've got a validated product. Same thing on the peptides. Make sure you have the COAs. Make sure that those COAs are not just purity, but they're also checking for things like water content using Carl Fisher analysis, and for heavy metal content to make sure there's not particulate or things in the product that could be dangerous or immune dysregulating, especially when many of these peptides are meant for immune regulation, right? So anybody can check for purity. Make sure when you're working with a company they are checking for more than that, like we do, and it can be independently verified through the third-party laboratory that's doing the testing. Those are some of the things to look out for. And then, I hate to make this a point, but price matters. Not everyone has the ability to afford regenerative medicine. If you can have a lesser costly solution that's more efficient in your practice, then hopefully you can price these services where you can help more people. It's great to have a $15,000 stem cell case, for example, but there's only so many people who can come in and do that. That's why we like to have multiple tools in the toolbox. We have PRP procedures from a couple $100s, along with other inexpensive tools like peptides, all the way up through exosomes, stem cells, and other therapeutics and muse cells, and so forth. So I like having, I guess you'd say, a broad menu of services so that we have multiple tools and we can help almost everyone who comes through our facility. And that's another pearl I'll leave you with. Whenever we do a new patient consult for regenerative medicine, we never let anybody leave empty-handed. I don't care if we're doing a trial session of Shockwave or we're giving them a 1-week sample of peptide capsules or I'm giving them a topical serum, or even a simple analgesic like a BioFreeze sample packet. If a patient comes in, they spend an hour with you, they go through the process, they apply for care credit, they get denied. They apply for a secondary patient financing like Cherry, they get denied. The worst experience somebody can have is they leave that office and go, that doctor could have helped me, but all they cared about was the money. And they're going to tell 100 people that if they're dissatisfied. If you have a miracle case, they tell 2 or 3 people, how good the experience was. So I always try to give somebody something to go home with therapeutically, or do some type of a procedure in the office, so they go, well, even though I didn't qualify for financing, they still did something to try and help me. That doctor really cared. And think of it like part of your marketing budget when you do that, and part of your community engagement and customer relations, if you will. That's really important. I look at groups like QC Kinetics that do a lot of marketing on satellite radio and big media, and they come in and it's expensive care plans. And it's kind of like a churn and burn model. If you can't pay, you don't play. And go online, look at the Google reviews. You'll see firsthand how people take that experience. So we try to be an antithesis to that and make sure everybody feels like they're being cared for by a physician, in a clinical setting, and it's not just a business that's trying to shake them upside down and extract every penny.
Yeah, exactly. So it's not transactional. It's not just the transaction. You're really trying to look at the overall scope, making sure that you are providing value to them and that they are feeling like they're getting taken care of. So I love that. Now, I know we covered a lot of different things, but I wanted to ask you this last thing. What is the most rewarding part of your journey in this industry? Like, what do you feel is the best part of what you do?
Oh, that's a tough question. And it's tied between 2 things. Okay. One of my favorite experiences is somebody comes in for their initial consult, and I've been told that bone on bone, I've had cortisone injections, the orthopedic surgeon said nothing's going to work. I need joint replacement surgery. Yet they're still in our office for a consult to try and avoid surgery, right?
Right.
So being able to say, okay, if I could show you in 5 minutes that I can correct that bone on bone contact, would you be willing to hear us out on a potential alternative? And putting an unloading brace on and doing a pre and post x-ray, or doing a trial shockwave session and getting an immediate improvement of range of motion in somebody with a rotator cuff tear. Getting that skeptical patient that comes in who says, nothing will work. My orthopedist said I need surgery. Well, why are you here, right? But let's break that skepticism. Let's overcome it. And then let's have a real conversation about how we can fix you. So I love breaking those fixed ideas and showing people that regenerative medicine really does work. There are natural alternatives. They work quickly. Even when traditional allopathic medicine has failed you, we might still be able to help. So I love that one. That's one side of it, overcoming the skeptic. And the other side of it is just the medical miracle outcomes that we see, getting that 86-year-old grandma who's in a nursing home that's in a wheelchair progressively out of that wheelchair so that she no longer has to be in long-term care and can shop for her own groceries and cook her own meals and feel self-sufficient and not feel like a burden on people. And when the holiday season comes, and you get the pineapple upside down cakes that are handmade, and you get the holiday cards from people, and they tell you how this has changed their life. And another thing that kind of goes hand in hand with that is the extension of lifespan we're able to provide to people. Thinking back to that same case, that 86-year-old grandma, she had early stage heart failure, COPD, morbidly obese. It wasn't just the osteoarthritis, And by the time we were done with her, all of those conditions that would have killed her relatively quickly were resolved. We probably extended her life by at least 5 or 6 additional years that she got to spend with her family. Like, we literally gave the gift of time, of life extension to that patient. And that's one of many thousands that we've had that interaction with. That's by far the most rewarding part of what we do. And it kind of circles back to the whole reason we created these companies in the first place. We want to make those medical miracles that are unlocked through regenerative medicine more accessible, so that we can have more stories like that one, so that we can impact and touch more lives. And so that when we're done with our brief time on this earth, the legacy we've left behind us is all those families and communities that have more time with their loved ones, that have better interactions with their loved ones, that didn't feel like a burden on their family, that had a better quality of life. And as time goes on and science advances and we get these AI tools that we can integrate into our workflows, it's just making us more capable to help these people and to extend the reach of regenerative medicine to more and more patients and communities that can benefit from them. And that by far is what I'm most grateful for. At the time, I didn't think that this knee injury was a good thing. Obviously, it wasn't a fun process to go through. But in retrospect, it's probably the best thing that ever happened to me. It changed the trajectory of my life, and I've been able to help thousands of doctors and hundreds of thousands of patients over the past 20 plus years as a result of that. So I'm going to go ahead and call that a happy accident, like when Bob Ross would make his little trees, except mine was a little more traumatic than that. So I'm very glad to be part of this. I'm very glad to share everything I've learned across that whole life cycle of, patient, provider, developer, now, published, patented inventor. Never thought I'd be able to say that, and share that with other providers and physicians and business owners and entrepreneurs so that we can expand access to even more and more people and help more and more families and change more and more lives for the better.
Yeah, man. Your whole journey, it sounds like one great experience after another where you built on a lot of different things. You have a wealth of knowledge. So I want to just thank you again for just talking with me, educating me on some of the stuff that's going on, what you've been doing. I definitely want to invite everybody to the Peptides Unlocked. That's going to be on March 25th. So if you have questions, you've had doubts about specific things, whether that's anything from regenerative medicine or even the peptides, just go ahead and make sure that you show up live so that way you can ask your questions to Lance and he can get those answered for you. So Lance, again, thank you so much. I appreciate it.
I'm happy to do that. I look forward to sharing those learnings with everybody and just expanding this great gift that we have. I mean, regenerative medicine is the last stop when allopathic medicine failed you, when you're about to go under the knife or give up and learn to live with it. So we have the unique gift to be able to take the people that are in the greatest need, that have tried and failed the most things, and to save them from going under the knife and having that cyclical result that eventually leads to rapid death. You see this in spine surgery all the time too. Somebody goes and gets a spinal fusion. 3 to 5 years later, they're getting a level above and below done in most cases, right? If we can stop that initial intervention and keep that downstream process from happening, I mean, you can totally change the trajectory of people's lives. We're doing it naturally. We're doing it ethically. We're doing it in an evidence-based way. I mean, how else would you want to practice medicine? I mean, regenerative medicine right now, it is the place to be. It's going to become the new standard of care. We're seeing 10% of all new FDA drug approvals as peptides. Another 10% are exosomes, mRNA, being used as a drug delivery system. The future of healthcare is regenerative medicine. It's going to be the new standard of care. You all are early adopters still, but 5 years from now, 10 years from now, your peers are going to be looking at you and wishing that they jumped on the regenerative medicine bandwagon when you did, and you're going to be the ones that are setting the new standard of care moving into the next decade. So I look forward to seeing all of you on the Peptides Unlocked webinar, March 25th, 1 p.m. Eastern, 10 a.m. Pacific time. I'm happy to share what we've learned and our pearls with you. Show up with your questions and concerns and your skepticism. Feel free to pepper me. We'll be taking questions at the end of it. And love to also hear about your experiences, and maybe you can also share your pearls and gems with the class as well, because we're all here to collaborate and help more people. There's plenty of people that need help from regenerative medicine. Like, that's one other thing I want to throw out there. Competition is not a problem in this space. Way more people need what we do than there is access to care. Collaborate with your peers. We get referrals from orthopedic surgeons all the time, from cardiologists all the time. NSAID usage is one of the biggest risk factors for cardiologists. If we can treat these inflammatory conditions, these MSK conditions, to get those patients off of oral NSAIDs, you're doing the cardiologist a huge favor. So think collaboratively, not competitively. You'd be surprised how many other physicians and what you might think would be competitors in your community would be open to being collaborators with you once you share some of these regenerative medicine tools with them. So look forward to seeing you on Peptides Unlocked, March 25th, 1 p.m. Eastern, 10 a.m. Pacific time. Thank you very much.
Thank you, Lance. Appreciate it.